and I believe that my insurance will be back come this time tomorrow. And I get a kick out of a lot of people who are completely against people who can't afford health care getting proper health care. Because there are people who believe, and I don't know how you could think this, that getting proper treatment medically is not a right, it's a privilege. A privilege? It's not a privilege to receive health care because we live in a country where the healthcare system and the way it's done is tops. There's no better country in this world. There's no more advanced medical nation on this planet than here in the United States. But I do not ever want to hear somebody tell me that it's a privilege to get good health care in this country, because it is not a privilege. It is a God-given right that if we are on this earth, we should be able to live on it and live in it our entire lives without having to worry about whether or not we make a payment to the hospital for medication, for a doctor visit, over whether to put food on our table on a daily basis. And there are millions of Americans who cannot choose the medication because if they do, they will starve. And then there are others who choose the medication because they want to feel and be well, but then come home and open up a can of pork and beans and eat that for supper on a daily basis because it's $1 at the grocery store, and that's all they can afford. Saab says it has to be a big catch. I'm a taxpayer and I can't afford health care. I have to pay cash. I don't go to the ER. Doctor visit only. I'm with you now. When I go to the doctor, it's cash. When I go for my medication, it's cash. And God damn it, it is expensive. I am lucky to have a doctor who knows the system and knows that if you have to take a certain medication and you dose it higher, you can get it and just split the dose and you'll get it for a substantially amount cheaper. In other words, if there is a medication that you took that comes in 1 milligram and 5 milligrams, it would cost you almost 5 times as much to get 5 tablets of the 1 milligram that it would to get one that's 5 milligrams. And so, thank God for the ingenuity that this doctor that I have has, because it has saved me thousands and thousands of dollars on a consistent basis. But I don't want to hear stories about senior citizens who have to make the choice whether to get their blood pressure medication or whether or not to have a decent meal on the table. That shouldn't happen. Under this plan, people won't have to make that decision anymore because they will have care, they will have coverage, and they won't have to make the decision whether it's easier to eat or to be healthy. And to be healthy, you gotta eat. So if you can't eat, there you go. And I think about people who I know, too, in my lifetime. Really, really good friend of mine. Not by choice, but because his company that he worked for was too small to provide health insurance at a reasonable rate, would have had to have paid a premium of about $800 a month. He screwed up his leg, screwed up his knee, and had to wait for months before he could finally get the surgery. You don't have the cash, you don't have the insurance. When it comes to certain surgeries, you ain't getting it. That means you got to hobble around like the Hunchback of Notre Dame. That's precisely what you're going to do. As Lowe says, too, pregnant mothers never see a doctor. High infant mortality rates. That's going to go down. That's going to go down. If that's a bad thing, tell me. I don't see that. I can't see how that's a bad thing at all. And I'm going to tell you something else. Again, I'm going to make this preface really, really clear. I still don't know for sure how I feel about this entire program. But I'll tell you one thing. If these senators and these members of Congress who are vehemently against the program are so vehemently against it, why don't they put their money where their mouth is and drop their insurance from the United States government and go for a couple of months without their insurance and see how well they do without it? Because it's very easy for people who have the best healthcare insurance in the country to tell other people you don't deserve it, or you don't deserve it, or you don't deserve it because you don't work enough, or you're unemployed, or you have a low-paying job. It's very easy for senators and members of Congress to do that. John Bonner did a good job of saying that last night. And so did a few other members of Congress who have the best health care in the world. Not just the country, but in the frickin' world. So why don't they take away their insurance and their medical benefits just for a couple of days and see how well they survive and see how well they do without coverage. The same coverage that the other members of Congress have, and the same kind of coverage that you and I can have now if this plan goes through well and is managed well and doesn't become an economic disaster as some have predicted. It's unfathomable. It's unfathomable. But that's the situation. That's where it is right now. That's what's going on. And that's why I really and truly believe some of these Congress members need to look at themselves in the mirror. They need to realize that what they're doing is wrong and acknowledge that something and some good things are going to come out of this whole healthcare bill. It can't be all as disastrous as what the people have been saying so much, so over and over and over and over.